over $1 billion lost to medical tourism abroad. And that number or that figure is increasing by the day. Why do we have to always go out to seek medical attention when we have all it takes here? When we have the expertise, we have the equipment, we have the infrastructure, do we have to keep going out? Well, the program is Stopping Medical Tourism. It's packaged to enlighten you and to inform you that all that you are seeking for in abroad, we have it in Nigeria, we have it in Abuja. My name is Joseph Kadri, and on today's edition of the program, our focus will be one of the leading causes of medical tourism, heart. Heart. And one would just wonder, between the heart, the liver, and the lungs, which is most important? But that's not the focus. But we're just looking at open heart surgery today. It's a leading cause of medical tourism. And we've got the expertise, we've got the equipment, all that you think is required for that surgery is done here in Abuja, it's done here in Nigeria. And of course, to look at these and issues surrounding the heart, I have with me the number one, Dr. Christopher Otabor. Very good morning.
Thank you. Good morning, Joe. Good morning, viewers.
Yeah, doctor, I just have to take that time to dwell on it. A little over $1 billion lost to medical tourism annually is really not impressive. And one of the causes for it is the heart, and especially the open heart surgery. I just want you to take us through what it entails in open heart surgery. Is it a mystery? Is it a mystery? Let's demystify it.
Thank you, Joe. The heart, like you know, is one of the most important organs of the body, if not the most. From when we are 6 weeks old in the womb, the heart starts to beat, and it must beat throughout life. Any time it stops, within 4 minutes, one will be brain dead. And if it stops for another 10 minutes, that's the end of life. So it's so vital to sustain life. And the heart has muscles, very tough muscles that contract to push blood out from it to the rest of the body. And the blood passes through certain valves, so the oxygenated and the deoxygenated blood does not mix. And so it's a very complex structure.
What do you mean by oxygenated?
Okay, the oxygenated blood is the one that is coming from the lungs. The essence of blood going to the lungs is to pick up oxygen that we breathe in. And then that oxygen is transported around the body because it's needed for our body metabolism. Then the one that has lost its oxygen, the body has a way of also taking it back to the heart to go to the lungs so that there will be exchange of oxygen. Yeah, so that's, and they don't mix. Oxygenated blood is the one that the heart pumps to the body. Deoxygenated blood is the one that goes back to the heart to go to around the body, that goes to the lungs to pick oxygen and go around. So that's the whole essence of the heart, to take fresh blood to the rest of the body, and also to take stale blood to the lungs for it to become fresh. So
that means it is the main organ for survival.
It's one of the main organs because the brain is also there. Without the brain, nothing works because that's the nerve center of the body. So there are many organs. The liver is also very vital for survival. The kidney is vital for survival. And if you look at these structures, the kidney, the liver, the heart, the brain, these are vital structures, and even the lungs. And these are the main reasons why people go abroad for treatment. Because if anything goes wrong with these structures, there's a problem, and if not well tackled, people can die easily. Even though every part of the body is important, including the bones and all that, the spine. Okay, so coming back to the heart, something can go wrong with the heart, either from childhood. Many children are born with heart diseases, which means either there's a defect in the structure of the heart, you know, or
in development.
During the process of development, the heart is not formed the way it's supposed to be. It's a complex process in the womb. The chambers are initially together, but before birth, they begin to separate. And so oxygenated and deoxygenated blood does not mix. But in some children, they are born with a hole in the heart. When you say hole in the heart, that means that separation into the two different chambers is not complete. And so we now have mixing of blood, oxygenated and deoxygenated, and that can lead to poor oxygenation of the body, because now you're having, it's like mixing pure water and impure water. What you're going to have is impure water, you know, and so the body is not getting enough oxygen to drive the system, the fuel, and so the child fails to develop normally, and many of them will die if nothing is done. Then also, but in adults, we have acquired heart diseases, whereby some, due to infection, like streptococcal infection, very simple, innocent type of infection, maybe sore throats, and then, depending on the type of bacteria, it deposits some complexes in the lungs, the valves, and then the valves, in the process of healing, become cicatrized. It squeezes the valve, and so the valve, once the valve is deformed, blood cannot push out, you know, to the rest of the body, because the valve is supposed to open for blood to go out and closes so that blood does not overload, you know. So if the valve is bad, then we need to do something about it. Then also, the heart muscle, apart from the fact that the heart supplies the rest of the body, the heart muscle itself also requires blood supply through what we call the coronary arteries. If those arteries are blocked, it can lead to heart attack. Yes, and it can lead to death. So, and they are very important, because if the arteries are blocked, the heart muscle that it supplies also dies. So before it gets to that critical level where it can stop the heart, sometimes to start with pain, you know. So when you do some special investigations, you will see that the vessel is narrowed. So we can do surgeries to bypass that narrowing. So there are many reasons why operation can be done.
Before we look at how these operations are done, can we know some likely signs of heart defect or heart disease?
Yes. For instance, in children.
So that for those that are watching, you just have to note it down. If you mention it and you are having such signs and symptoms, you know that you need to check that out fast.
Yeah, in newborn, you see that the baby is blue instead of being pink. Blue, yes, bluish coloration. Yeah, because when there's not enough oxygen, the blood will be bluish. And then the child is failing to thrive. It's not growing. And then maybe cough and upper chest infections, you know. And I mean, you see a 1-year-old child who is supposed to be walking, you know, big. It's just like half of the weight, the normal weight, and refusing to try, refusing to walk, not able to eat well, you know, and all that, always coughing and weak. So a test is done, echocardiography is done to check. Sometimes even just simple X-ray of the heart can give it away. Then the echocardiography is done. Once you see a cardiologist, they will tell you that something is wrong with the heart. Then for adults, an adult that was healthy before is now having problem coping. Is not able to do the normal activities, is weak. You know, before you climb a flight of stairs, you are panting and all that. Some of those causes are operable, but others are not operable. So it is the doctor that will tell which one is which. And then also sometimes we have pain, chest pain, you know, with exertion. As you walk a little, that is common with blocked arteries. You know, you have pain in the chest and all that. Sometimes people just pass out and then they are revived and all that. So weakness, you know, and so these are some of them swelling of the legs and general lack of energy. These are some of the signs.
Now, for adults, is there any link to lifestyle? You know, maybe too much of alcohol, too much of cigarettes?
Well, lifestyle would lead to blockage of the vessels. Yes, like too much fatty food, lack of exercise. Smoking specifically is implicated a lot in disease of the blood vessels, which blood vessels is also present in the heart. So, yeah, this lifestyle can predispose to cardiovascular disease. Very important.
Okay, now let's look at expertise for open heart surgery. Before that, look at the implication. You know, implication of the rate of survival.
Oh no, okay. Open heart surgery anywhere in the world is a very complex surgery, and depending on the stage of the disease, survival is good because survival is dependent on what we went to do. Yes. If it's simple bypass surgery for the blocked vessel, survival is excellent. Everybody is supposed to come out alive. If you have the right expertise and you have the right equipment. Yeah. But in very complex conditions, survival can be a problem anywhere, whether here or there are precedents of nations that have gone in for heart surgery that didn't come out alive. But that's the exception rather than the rule. The rule is that people survive, and but survival depends on when you come. Some people have the problem and they've gone to all sorts of native doctors, prayer houses. Those ones, yeah, it's good to pray, but it's also medical knowledge is also a miracle. Yes. So if you come early, it can be sorted out. But when the body is already weak and cannot withstand the surgery or the consequences of the surgery, survival is low. Yes.
So you are saying early arrival is
early presentation, early decision to operate is important.
Okay, quickly now the expertise. We know that the program really is how we can disabuse the minds of Nigerians from going abroad to spend their hard-earned naira there. Because if you are going, you're not going alone. It's either you go with a family member, go with somebody that will be looking after you, and when you, of course, get there, you may not have a home there. You may not, even for those that have houses there, you just have to spend more time in the hospital, you know, than in your private house if you do have.
For the sake of time, in Nigeria, there are very few centers that do open heart surgery, and just a few here and there, and the burden is huge because 0.5% of children born would have one form of congenital anomaly or the other. And a good number of those children will require surgery to correct it. Some of the surgeries are very minor, but others are major. Okay, there are a few private hospitals that have done open heart surgeries in this country. And I think Alliance Hospital was like the third private hospital in the country that started it. Initially, when we started open heart surgery, we discovered that the cost was high. So we did a few cases, but we were collaborating with some surgeons from the United Kingdom, and UK cost is quite astronomical. So we had to stop because of cost. People could not afford it. But just recently, we have signed a memorandum of understanding with some Indian surgeons, excellent guys, and the cost for open heart surgery is almost half of what we used to do before. And the first batch of this new arrangement is by the end of this month. Yes, and with our goal is to do maybe about 20 open heart surgery in a month. Yes, and the numbers are there. The problem has always been the finances, because many of the people are poor. People who have this condition, they are poor, they can't afford it. So we are bringing down the costs. So, though it's still expensive, it's just like you want to go and buy a Mercedes-Benz car. If it is normal, if the normal price is 10 million, even if you get it for 5 million, it's cheap. It's cheap for that price. But if you don't have the 5 million, it's still a problem. Yeah, so the expertise has come. The expertise has come to stay in Nigeria, and we have it in Alliance Hospital. The way you say expertise, it involves a lot. There are layers of experts. Of course, on top of that list is the cardiothoracic surgeon, that's the lead surgeon. Then we have the intensivist, the intensive care doctor, who follows through after the surgery, because after surgery care is also very important. Then you have the intensive care nurses. You have the perfusionist, because during the open heart surgery, a lot of interesting things go on. Because for you to operate on a heart that is beating, I mean, if you put a knife there, you're going to have blood all over the place. So the heart will have to be stopped. Yes.
But you said if the heart stops for 4 minutes, the person may like.
Yes, that's where I'm going. But for you to do a successful open heart surgery, something else will have to take the function of the heart and the lungs, and that's what we call the heart-lung machine. Yeah. So all the blood in the body is diverted to the machine. It's a very big machine, very complex machine, very fantastic machine. So that machine does the function of the heart and the lungs. It takes away the deoxygenated blood, replaces it with oxygenated blood, and then pass it back to the body. And the body is just doing well. The surgery might take 8 hours. The machine is working, and then when the surgery is done, the heart is shocked back to life, and then the blood is returned to the body, and life continues.
Where you said cost there is that machine cannot be stopped. That machine cannot stop working.
No, it can't stop.
Either you are sure of using power from the grid.
No, we have a UPS. During the open heart surgery, whether there's NEPA light or not, it's immaterial. There's a huge UPS, uninterrupted power supply, that ensures power continues to flow to all the systems, even up 2 hours after the grid power has gone off. The UPS just continues to supply power. So of course, you can't be talking of big surgeries like this and be bothering your head about whether there will be NEPA light or not, or PHCN. It doesn't. You just cut off. In fact, you can trip off PHCN and still you have to get the job
done.
Okay,
it's an amazing thing that some private hospitals are doing in Nigeria, particularly in Abuja. What sort of support has the government been able to render? Most times you talk about PPP is the way to go when it comes to healthcare. What have we had?
I think the government has enough problems. Let's leave them to solve their problems. I know that the future of healthcare is in the private sector, tertiary healthcare. And the private sector, especially in Abuja, is rising up to the occasion. There are a lot of great things that are happening now in Abuja, such that in the next 3 to 5 years, there will be hardly any reason why anybody wants to go out for treatment, except he just wants to go. But if it's in terms of what is available, I mean, you will have almost everything in Abuja. Yes, Abuja is becoming a hub of medical tourism in the country. A good number of our patients come from outside of Abuja because they see us on the internet, they hear about us. In fact, some colleagues, they call me from outside the country and talk to me about their relative that they want to bring to the hospital, both for kidney transplants, open heart surgery, brain surgery, spine surgeries, and so on and so forth.
Wow. Okay, this is a time where we offer you free consultation. If you have questions or comments, you can call in. The number is on the screen to, of course, ask Dr. Otabor where you have issues. Like we've been talking about, you have pain in the heart, where you walk just for some miles, you have difficulty in continuing that walk. You climb staircase, you have issue, you breathe fast, your leg is swollen, and and the likes. You just have to seize this opportunity, call in for yourself or for a family member, for a friend, so that you get this consultation free. Okay, moving on. Doctor, this equipment that we talk about, I know you don't want to bring government into it. It is expensive. Can we talk about some kind of waiver, you know, so that as the, you know, tax for this equipment is reduced, it will also, you know, go down to the cost of treating or doing open heart surgery. Hello, good morning.
Good morning.
Your name and where are you calling from?
My name is Festus. I'm calling from Nasarawa.
Okay, Festus from Nasarawa. Quickly, your question or comment?
It's my question. Why is it that sometimes the two legs will just be swollen? What is the cause?
Okay. We've talked about one of the reasons, which is problem with the heart. And then if also there's a kidney problem.
Okay, you can listen to him.
If there's problem with the kidneys, it can lead to swollen leg. If there's a problem with the liver, it can lead to swollen leg. But apart from all that, even if there's no problem, if you keep your leg in one place for a long time, maybe in the process of traveling or sitting down for a long period without exercising the legs, it can swell up. Because we often say in medicine that there are two hearts in the body, the one in the chest and the one in the calf. The one in the calf helps to push blood as we move around. It helps to pump blood back to the heart. So if you stay in one place without moving for a long time, the legs can be swollen. So what to do is you elevate the leg on pillows when you are sleeping, the swelling will go down. But if it is persistent, then it needs medical attention.
Okay, I'm sure that is clear for the caller from Nasarawa State. And in case it continues, you can locate number 5 Manufacturing Close, where you have alliance with all the expertise to look at how that can be addressed. Okay, we have another caller. Hello, good morning. Hello, good morning. Okay, we lost him. Oh, I don't know. Okay, I was asking the question of how this cost can further be reduced if we have, if there's any possibility of pushing for waiver.
Yeah, there are many things that add to the cost of treatment for heart surgery or any of these big surgeries for that matter. Like you rightly pointed out, equipment is one of them. Then the consumables, like the oxygenators that are used to ensure that the blood in the heart-lung machine is oxygenated before it comes back to the body. The manpower, so many costs are involved. If we have factories in Nigeria where some of these things are produced, it will reduce costs. And these things, there is not rocket science. Okay, that's one. Two, the issue of the waiver, tax. If the government would give tax holidays for some of these equipments to come in to this country for free without tax, especially those ones, those high-end equipments, it will reduce a lot of, it will reduce cost. Okay, and then two, if we can encourage the system to drive volume. Okay, if we drive volume, we do several hundreds every month or thousands in the year. At the end of the day, the cost will reduce. Let's take for instance, if I'm flying in a surgeon to come and do maybe it's usually a team. If I fly in a team of let's say 5 experts to support the local manpower to do a open heart surgery here, if we are doing 3 cases, maybe their total cost will be $30,000. I mean, for all of them to come, hotel bills and all that. But if we are doing 50 cases or 30, you can imagine that, okay, the cost will be $1,000 per case, for instance. But if we are doing 3 cases, it will be $10,000 per case. Just expenses of, the logistics and all that. So you can see if we have more of the people, coming up for the surgeries, and the government can put a fund aside and say, This fund is subsidy for
actually
open heart surgery. Maybe 1 billion naira in a year. You can do you can save a lot of children, a lot of people.
Because that is not captured in the NHIS.
Yes. Well, NHIS, they do formal sector funding. They do some of these things. NHIS has sponsored a few people to do heart surgery in my hospital before. Yes, it's not normal NHIS. It's special case.
Okay, like private NHIS.
Yes.
Okay.
Not private. It's government NHIS, but special.
Hello, good morning.
Hello?
Hello, good morning. Your name and where you're calling from?
My name is Don. I'm calling from Lupe.
Okay, Don calling from Duse. What's your question?
What?
Let me hear your question.
I can't hear you, sir.
I said, what is your comment or question? Okay, I think you have to call back. Don has to call back. Okay, let me just ask this one before our time is used up. For somebody who is diagnosed to have heart issue and needs a surgery, how long will the person go, to have it done without which the person may die?
Well, it depends. There are different conditions. There are different diagnoses. Yes, you can't predict, but in children, it varies too. Yes, as the child grows, the need for oxygen is increasing. Yeah, some people can do 6 months, some can do 1 year, some would have only 1 month to go, some 1 week. It depends on the presentation, depends on the diagnosis. So there's no rocket, no one size fits all answer.
But the earlier the better.
Yes, the earlier the better.
Okay, the program, of course, is Stopping Medical Tourism, and today we have looked at open heart surgery, and of course, it is one of the leading causes of medical tourism.
Sorry, those who would need it. I mean, we're having one batch by the end of this month, or between the end of this month and first week of November. Those who would qualify to have surgery then will have to come now for evaluation, so that they can be prepared against that time.
Yeah, I have to say that again. You want open heart surgery, your family member wants it, your friend, people that you know that need open heart surgery, Alliance Hospital is there at a subsidized cost with, very high expertise. I mean, the team is known all over the world. Come to 5 Manufacturing Close and have your name registered. By the end of the month, you will be among those that, of course, will have the surgery. If it's not end of the month, the cost is usually high, and which is why you have to make yourself available to what you're saying, to that address. The phone numbers are there, and of course, you just reach out to this very high-tech hospital and register your name. By the end of the month, you may just be among those that will also be operated on when it comes to heart surgery. And it is not only heart surgery that is obtainable there. It is a home for so many specialties. Talk about orthopedic, talk about urology, talk about kidney, talk about brain surgery, talk about spine surgery, talk about knee replacement, talk about hip replacement. That hospital has all the services, and of course they can even come to your home. They have very, very good ambulance service, and one call they are with you. Hello?
Hello, good morning.
Good morning, your name and where you calling from?
My name is Remy. I'm calling from Asokoro Extension.
Okay, Remy, quickly your question in 30 seconds.
Okay. Please, firstly, I want to say good morning to my able doctor there, Pastor Chris Otabor. Please, sir, I want to ask a question. I have this new problem for some years now, and I'm 35 years old. I want to ask if it's possible for me to do surgery because the leg now is affecting the other leg.
Yeah, it depends on what it is that is causing the pain. I think it needs to come to see an orthopedic surgeon who will evaluate and advise appropriately. It's not all knee problem that requires surgery.
Okay,
Thank you.
All right.
Thank you, sir. God bless you, sir.
Thank you, and you're the very last caller here. Dr. Amos, thank you for coming on the show this morning.
Thank you.
And viewers, tomorrow there'll be a repeat broadcast of this. And of course, same time, same station. Next week, Saturday, we'll be here again with an interesting health topic that will be discussed. I'm Joseph Kadri. Bye for now.